Everything we know from research tells us that life satisfaction depends on good physical and mental health. Yet 1 in 8 children and young people aged between 5 and 16 experience a diagnosable mental health problem, and half of all adult mental health problems start before the age of 14. Early intervention is vital. That's why the Anna Freud Centre has been developing the Mental Health Services in Schools and Colleges Link programme, funded by the Department for Education. It helps everyone in education and mental health to think differently and develop new ways of working to give vulnerable children and young people the support they need when they need it. The programme uses a framework known as CASCADE, which covers 7 domains, from having an agreed point of contact for mental health to having a common approach to outcome measures. CASCADE empowers people working in education and mental health to feel confident about what to do and where to find help. Evidence shows it's working. Independent evaluation of the programme's pilot phase found improved joint working and frequency of contact between schools and colleges and NHS children and young people's mental health services, increased knowledge and awareness of mental health issues, and confidence in supporting children and young people experiencing them, improved working methods and processes, school-specific referral protocols, improved understanding and awareness of referral routes, better quality and consistency of referrals, and early signs of changes to whole school or college policies, resources and staffing. The Government Green Paper, Transforming Children and Young People's Mental Health Provision, ensures support for schools and colleges in promoting mental health by introducing training for designated senior leads for mental health in all schools and colleges by 2025. Mental health support teams working with schools and colleges rolled out to between 1/5 and 1/4 of the country by 2023, and teaching about mental well-being in health education and relationships and sex education from 2020. Implementing the CASCADE Framework will support you in working towards the Green Paper's proposals for designated senior leads in mental health and mental health support teams. By working together, these teams will champion mental health and give all staff the confidence to work with other professionals in supporting children and young people. By helping education and mental health professionals plan together more easily, the programme enables early intervention before problems escalate. It also joins up and simplifies the process for children and families, giving them confidence as well as consistent, appropriate support from a connected team. It's a step towards a systemic change, supported by wider Green Paper proposals to help children and young people when they need it, and work with them and their families to build a strong sense of well-being and resilience that we hope will last a lifetime.